why don't we talk about the industry as a whole? And, you know, I know you've been keeping tabs on the industry, as many veterinarians have been. You are one of those individuals who is thriving in the industry. And you know, I'm finding that we go into it, none of us go into it to make a lot of money. At a team meeting, we talked about this. None of us go into this to make a lot of money, but of course you have to be at the level where you're able to survive, paying off your student loan and surviving on the whole. And I just wanted to get your take on that. And how do you feel about the industry and its future?
Mike, that's a really hard question. You know, it's a tough question because I graduated vet school in 97. So not that long ago, 18 years ago. And the field of veterinary medicine has changed immensely in those 18 years where, when I first started, there was no internet, that was the first year we had email and, people weren't going to the internet for Dr. Google to diagnose, their dogs or their cats with medical problems. There wasn't social media. There wasn't online reviews, and it has changed so much. When I was in vet school, it was probably 60% female, 40% male. And some of the vet schools now are 100% female. I would say that the average statistics based on the American Veterinary Medical Association, it's approximately 80% or 78% in each class is female. So it's becoming a female dominant field. And I don't think that's necessarily a bad thing, but I do think we have to be cognizant of multiple factors that you brought up. One, because of it becoming a female dominant field, in some situations, women want a family plan. So they are dropping out of full-time practice to have a family, which they totally should while they're young and they can. And as a result, we're seeing a large population of our matriculating veterinarians that only practice for 5 years and then go into part-time. And when they go into part-time to family raise, that's an awesome benefit in that our field is so flexible where we have that flex time and we can offer that, which is fantastic. It's really supportive of work-life balance and family life, which I think is important. There's a couple of negative aspects of it that we have to be cognizant of, though. Sheryl Sandberg talks about it in her book, Lean In. And women are such planners. I know I am. So in 5 years, I'm going to be doing this. In 2 years, I'm going to have a kid. So it's hard where when we plan so much, we lean out and say, I can't buy a small animal practice because I'm going to be too busy raising 2 kids and working part-time. I'm not going to be able to pay off my school loans. And I really encourage people who, male or female, if they're thinking about going into small animal practice ownership, that they do it sooner than later. Because even though you have a large debt load, you have the equity, you have the power as an owner to work your schedule and to make it the practice and the quality of medicine that you want it to be. So rather than lean out, I really encourage people to grasp those opportunities. Veterinarians are lucky in that we have so much job flexibility. Look at me. I did a emergency critical care specialty and then a toxicology specialty. And then I worked in private practice and academia and then went into industry. And we have that flex opportunity to do, honestly, whatever we want. We want to work just weekends. We want to work overnights. We want to work in industry. We want to be a zoo vet or, travel across the world and spay and neuter. There's so many opportunities in veterinary medicine. I guess the cons are we, as a profession, and this is my generalization, we don't pay ourselves well. And I think we undervalue, if someone has financial constraints, we are such a giving profession where we're like, well, that's okay. You can just, bake me 6 apple pies, right?
Oh, yeah.
And
yeah.
So it's really hard to pay off our school loans with apple pies or cookies or things like that. And we totally appreciate it, but it is something where it's hard. When I graduated Cornell almost 20 years ago, I walked out with $100,000 in school debt. And I was really stressed from it. It really stressed me out my first 2 years of veterinary school. I worked 3 jobs, during veterinary school. And then, when you do an internship and a 4-year residency, you delay your student loans even more, and that interest really compounds. So it is a huge stress factor where in human medicine, or even in human dentistry, or even in human nursing, you would make more money and recoup that salary back and be able to pay off your loans. So whether or not, I think pamphlets should be made encouraging people not to go to vet school, I'm not sure about that. But I do really think, I feel like all of us, I'm sure you included, we all wanted to be vets when we were young. We all fell in love with veterinary medicine and animals and the human animal bond. But I do think people need to be cognizant. 8 years of school and 8 years of school debt, when you make an average between 60 to 80 to 100,000 when you get out, it's really hard to pay that off when you have a mortgage and you have to put kids through college also. And I'm super happy. I'm sure you are too, because I feel like we have pretty good work-life balance and try to keep it real. But I really feel for the newer generation or the millennial veterinarians in trying to balance being a mom, working part-time, and paying off their school loans. So I do think it's a big issue that's going to affect our profession.
So let me just go back to a couple things. The reason why there's the higher um, female to male ratio now in the vet schools is because, and I always use this term, it was an old boys club, and
Sure.
you see that with the retiring selling practice owners. It's really a bunch of men selling and
Hmm.
so forth, and one of my classmates enjoyed the ratio of male to female. Very
Sure.
much so, my single classmate. But the reason that exists, and that is changing the dynamics of the industry. But as you say, I mean, I look at the reason what attracted me to the profession was I always use the term jack of all trades.
Hmm.
The ability to do so
Absolutely.
many different things that human neurosurgeon told me that he goes, my life's okay, but what I do most of the time? I do carpal tunnel surgeries, and it's not
Wow.
exciting. I get the
Yep.
odd brain tumor or something you say. So I took that to heart, and it
Hmm.
was interesting that I can do all that, right? And it
Hmm.
was fun, appealing to me. And then, in addition to that, you enter the profession and you find out there's things, the stuff me and you are doing right at this moment is
Right.
completely outside of what you
Totally different.
perceive, but
Yep.
it is still part of the profession. I think that's what a lot of the young people should realize, that there's a lot of opportunities out there.
Absolutely.
Yeah.
Absolutely. And I'm still really supportive of it. I do encourage people, if they're even wavering and they're not 100% sure, to really make sure that they have a lot of animal experience. They volunteer at a veterinary hospital, so they know what it's like. And the reason why is it makes me sad when I see veterinarians who are burnt out and have compassion fatigue after 5 years in private practice. And that makes me sad because, you've worked your whole life to get into vet school. And so I really encourage people to look and think outside the box. There's so many opportunities that you have out there.